the basis of this talk is kind of more about the philosophy of what we're trying to do at USSA to prevent injuries that occur in skiing, and then take that information and be able to pass that down to you guys so that you can hit those athletes at a more younger ages that we see up here at the elite level, and try to facilitate a healthier, stronger athlete for you, but also for us. So so this first slide that I have here, this is kind of the philosophy that we're using in our sequence of injury prevention, and this is based off of a study, kind of a landmark study back in the early 90s by Van Mechelen. And this is really the blueprint that most organizations are taking when we're talking about injury prevention. So usually what you have to do is if you follow that chart, the first thing is establishing the extent of the injury or the problem. So we're really looking at what injuries are occurring out there and how bad are they. After you know what those injuries are, you kind of go back and you try to figure out the etiology of those, how often they're happening, as well as how they're happening and what's the mechanisms of those injuries. After you have that information at hand, then you're able to kind of come up with a preventive measure or an intervention to try to decrease some of those injuries that are occurring. And then the last step, of course, is going back and assessing whether what you're doing is actually helping or not. So we've taken that model and have really started moving forward with the club system in particular by having an injury surveillance project that are out there to you guys. We want to see what kind of injuries are occurring with you guys, but we also know what's happening with us as well. And some of the ways that we found out some of the information is that on this slide, the FIS has an injury surveillance project that they've had going since about 2006. And what they're doing is they're kind of looking at all their different disciplines. They're doing athlete interviews. At the end of the season, they're calling each and every athlete to find out, did they get hurt, when they got hurt, what the injury was, did it take you out for a lot of time? And so you can see they have quite a few interviews to date, over 6,600 interviews with athletes. So it's a very good ongoing process, but it's really only at the elite level. And one of my goals here at USSA is to try to emulate or try to copy them, but more on a club-based system. So we know that we have lots of numbers in our club system out there that we think we can get really powerful studies that can really be useful, not just for our sports, but for other sports as well. This next slide, just kind of more of that injury surveillance study. And if you go into the fisski.com and get into the medical page there, you can pull these up, and they're updated every year. This slide just kind of shows what injuries were occurring out there from 2006 through 2014. And if you take a look at the knee, the body part that's injured under knee, you'll see that they far outnumber any of the other injuries that are occurring out there. So bottom line is just those numbers that are occurring overall in each discipline, and then it's broken down by body part. So hand is a big one. The low back is a big one as well. The head and face, that includes concussions as well. So lots of injuries are occurring at that elite level, but the knee by far is almost 40% of the total injuries that are occurring. So if you just pick out alpine skiing alone, and this chart kind of comes from that same study, and this is knee injuries per 1,000 runs. So it's based on a little bit different rate, and a little bit different method of how they're measuring it. And you can see by their knee injuries, they've broken it down by the number of knee injuries that occur per 1,000 runs, as well as the number of ACL injuries that are occurring per 1,000 runs as well. So not all knee injuries in and of themselves occur in an ACL injury, but about half of them do according to this. And this is throughout all 7 seasons as well. So our big goal here is to figure out why those ACL injuries are occurring and who they're occurring in. We know that mostly they're occurring in females. The ACL epidemic in young females in the United States right now is at an all-time high, even though lots of things are being done to try to prevent that. So a huge goal for us is to try to prevent those ACL injuries. And what we do know is those ACL injuries are occurring in females from 14 to 17-year-olds. So for us, back in the day, was that if you were a female alpine skier, you've already blown your ACL by the time you get to the World Cup level. And so that's something that we're really trying to avoid, because we know that those ACL injuries can really take an athlete out for up to 2 years before they're really back to that level that they were before. So That combined with the long-term effects of an ACL injury in females or anybody else is that the onset of early osteoarthritis is very prevalent. And we know that that's going to happen to these girls. So now when we're looking at 14, 15-year-olds setting themselves up for osteoarthritis in their late 20s, early 30s, we know that something needs to be done to kind of prevent that stuff. So these are just some numbers on this slide of season-ending injuries by sport within USSA. So when I came on board, we started compiling this data. It's broken down by discipline as well as by the year, and some pretty dramatic numbers. Now in 2012, when we added the free ski program, we saw a pretty high number of athletes getting hurt within that sport as well. And so overall, even though we're doing a lot of preventative techniques with our athletes, our numbers stayed about the same because we added more athletes and actually saw an increase in injuries in and of itself. A couple things about the numbers and the statistics of those is that right now we have about 250 national team athletes, and we see about a 17 to 19 or 20% season-ending injury rate. So that's any injury that occurs from September through the season that takes them out for the rest of the season. So that's about 30 athletes. So that's a pretty high number for us. And that can be, that's varied. If you take a look at this other slide, there's a lot of different season-ending injuries, but by far, again, the knee is what's really taking us out. So of those 30 athletes that get hurt, about 20 of those are knee injuries. And of those 20, about 15 of those have an ACL component involved in it. And then the other alarming thing that we're seeing is that we're not seeing just ACL injuries occur, but we're seeing a lot of cartilage issues with those athletes occurring at the same time. So meniscus injuries, articular cartilage defects are occurring, and that's very alarming to see that occurring in a very young female at a young age. And it's the size of those defects now are very large, just from the manner of the traumatic type injuries that are occurring. So we see a lot of other things as well. So if we get our number of dislocated shoulders, that takes somebody's out that needs a surgery. We usually get 2 to 4 concussions per year that take a longer time than normal, over that 6 to 8 weeks to actually recover, where the normal recovery time is usually around 2. So the concussion numbers, those that are occurring like late in the season, get counted as season ending, even though they may take like 4 or 5 weeks to totally recover, that they would normally come back from the season, but they occur so late in the season that they're out for the rest of that time. So one metric that we're starting to follow now is just the number of days lost, and this is a very interesting metric. As you can see, this pie chart is kind of based off of the 108 injuries that have resolved. And so these are athletes that have returned to competition since September of 2013. So this is about 2 seasons worth of data. It occurred in 79 different athletes, because some athletes sustained more than one injury or in that 2-year period, or sustained more than one injury within the same incident. But really, when you start seeing these days lost, this is amazing, because even in our free ski world, that pie chart that's represented in the red, we've lost over 10 years of training days in 2 years. And even in Nordic we've lost almost a year. So when we look at the metrics this way, it's really alarming to us to see how much time we're actually losing. And once we put a dollar sign onto that, I think it's really going to blow us away. So.
Al, there's a question in the chat box.
Sure. Oh, yeah. Lewis is asking, telemarking has low numbers. Is that because your pool of athletes is lower than free ski and alpine? I believe so, Lewis, because I know that we don't work with a lot of elite level telemarkers ourselves here. I don't know how large the actual tour is, because those are FIS numbers that occur on their World Cup system. So a lot of it could come just down to the number of actual World Cups they have. If they only have 5 or 6 World Cups, then maybe the injury rates are lower. I also noticed with telemarking too that their knee injuries are actually lower too. Part of that could be just that with the free heel, they're not, the lever arm is changed a little bit. The technique that they ski could be changed a little bit too. So hope that answers your question. Okay, so moving on. So if we go into the next step of Van Mechelen's model here, we see that we want to establish the etiology and the mechanism of injury. So etiology is kind of looking at the risk factors. And when we're talking about skiing, risk factors are varied and very many, as you can see. It's not just the athlete themselves. Like, is it the skier technique, how they're skiing, how they're being coached, the strategy in and of itself? Are they being more aggressive on certain days versus others? Certainly the weather, the piste, the snow conditions definitely come into play, particularly when we're talking about acrobatic type sports, the half pipe or the slope course, where snow conditions can really affect your speed and really play a factor. The course set now they're looking at as well to see how different sets have put the injury, put the athlete at risk as well. And then equipment has always been out there and has been studied since early 80s. Chris Brown has done an excellent job out in Vermont to look at equipment, how that can be affected. The recent change in the GSE by the FIS is an attempt to try to work on equipment to try to decrease those injuries as well. But if you really look at the puzzle itself, it all comes into play, and we're really working, concentrating, myself anyway, our department is really concentrating on this athlete component. We are working with coaches to talk about course and training techniques, learning to when to shut it down, training for a day, how many days that they're actually on snow, or are they putting at risk, how many time zones do they cross before they actually get into high competition training levels. And then another thing that we're trying to do is really look at rehabbing our athletes the correct way and what the right time frame to bring that athlete back is. We know that there's a certain level of chance of re-injury once someone goes down with a knee injury or a post-surgical knee. And what we're trying to do is bring that athlete back to try to decrease that re-injury rate. There's some recent studies now by Tim Hewitt and his bunch out of Mayo Clinic that are stating that bringing female athletes in their teens back to high level activity before 2 years gives them almost a 40% chance of re-injuring that knee or injuring the other knee. So that's a dramatic number. And so we're really trying to figure a good system out how to bring our athletes back to snow in a safe manner and then progress them in a safe manner to try to avoid that re-injury rate. So when we're talking about risk factors, we do a lot of screening with our athletes and not just physical screening. But one of the big things that we're doing around here too is that we're taking a really good medical history of our athletes. So the biggest prediction tool that we know that is that if an athlete has been hurt once, then the likelihood of them getting hurt again is high. So what we have is we use as a very database of questions that it asks athletes about their past medical history that includes injuries and illness, as well as vaccination rates, prior surgeries, all that stuff. And it's kind of based off an IOC paper, that consensus paper that was done 5 or 6 years ago. The database is over 1,200 questions, but it only queues up the next question if they answer yes to somebody. So in prior history, a lot of those medical histories are like a one-page sheet, and it says if you answer yes to something, there's always a little box on the bottom that people don't fully fill out. So we feel like this is a really good system. It's electronic, it's HIPAA compliant. You can give it to the athlete, they can sit down, they can go through it. They don't necessarily have to do it all at one time. But we scan these and we go over these really thoroughly when we get a new athlete to our system. And then what's really cool about it is that when they come back the next year, they only have to update it, which only takes about 10 minutes. So that's our first step. And then we always do an annual physical exam as well on our athletes, just to make sure that they're good to go when they start their season out. So another screening technique that's done a lot is just this FMS, or the functional movement screen. We've actually have gone beyond the functional movement screen here at the COE and have developed our own called the U-Start program. But basically, we're just looking at how athletic and how does the athlete move. Very simple exercises, but can get a lot of information that may foretell you whether they're at risk for injury or not. So some kind of screening battery like this is always useful when we're looking at coordinating and implementing dry land activities or dry land workouts as well. These two pictures are representative of a screening technique that was developed by Greta Mikkelburst in Norway. And she's done a lot of research in female non-contact ACL injuries. particularly in team handball as well as soccer. And she uses these two screening techniques to look at females to see if they're at risk. And the picture on the left kind of shows the one girl with a nice inline knee bend single leg squat, but the girl on the right kind of has this valgus collapse. And then the picture on the right shows a drop test, a single leg test, whether they're caving in. So that picture D is what you'll see in females or even guys that really puts them at risk. And what you really want to see is that nice top row of photos where their knee is over their toe, they're getting down deep, and they're not caving in. So we do some kind of forms of testing like that as well with our athletes. It's amazing to see how talented and how strong athletes you actually see actually have this kind of landing mechanics. This is a picture of actually, this is RG3 at his rookie combine test doing a broad jump. And as you can see in that bottom lower left picture where he caves in on both knees and then bounces out or jumps out, it's really amazing to see this after the fact that he's had a really severe knee injury in the past. So the screening does work. And then the idea is to be able to have an intervention and education aspect to be able to prevent these kind of motions. So just kind of moving on to ski mechanics now. So Tona Berra and the Oslo Trauma Institute, who actually do the same FIS injury surveillance stuff, they did this study in 2011 where they took videos of 20 different ski accidents that resulted in knee injuries, and they were able to kind of break it down and analyze it, and they came up with these types of mechanisms of injury in alpine skiing. And what you can see is that they've been able to, the first three, the slip catch, the landing back weighted, and the dynamic snowplow are really the big three and make up the majority of ski injuries to the ACL and to the knee. So now that we're starting to learn how the mechanics are occurring in alpine skiing, now we want to be able to kind of figure out, is there ways to prevent that either through equipment or through athletic training or dryland programming or education and landing mechanics and such. But I got some slides here that kind of represent each one of these mechanisms. So this is a slip catch. As you can see in that picture A, the skier's coming in late to his gait and he actually loses his edge on his inside ski. So what's happening is when they lose that edge, they get a quick internal rotation of their knee, because what will happen is the tip of their ski will catch and then they'll blow their ACL. So they're actually in the middle of a turn, blowing their ACL without even having a crash or sustaining a crash. This is a video of one of our own athletes. I'm going to switch over to this YouTube video and you'll see this. So this is a really cool video. As you can see, there's a skeleton superimposed on Racy's body here. This was done by Trond Hosgog from Norway, who does a lot of biomechanics, and he's really taken this technology to look at mechanisms of injury. So you see she's coming into this left footer turn, and she's going to lose her edge, and then she gets this quick little jolt right there, and that's what blows her ACL out. So I'll kind of show that again too if you want to see that a couple times. It's a pretty quick video. Okay, here we go. So as she's coming in, she's going to lose her edge, and she puts all of her weight onto that uphill ski, and then she gets this quick turning or quick jerk of her downhill ski that takes out her ACL out. It really only takes about 3 millimeters of translation of your ACL to actually blow the anterior medial bundle. So it doesn't take a lot of motion. It just takes the right motion and the right forces that occur to actually take that out. And this was an isolated ACL injury in itself. Okay, the next mechanism is just this landed back weighted. You can see by these photos, the skier's kind of coming off the jump, and when they land, they're landing in the back seat, and then they get that valgus motion of their left knee when they land. So the combination of landing back, having all of your weight on that back seat there, and then a little bit of a twist of the knee will take that ACL out. And then there you're kind of seeing more cartilage issues happen as well, because just the anatomy of the femur is pressuring the meniscus and the cartilage. So, and sometimes you'll get a combination of like the slip catch and the landing back weighted as well, which is kind of interesting as well. So here's Lindsey Vonn when she blew her ACL out in World Championships 3 years ago. She comes off that Super G jump, and in the this photo here on C, her right leg gets caught in the soft snow and she has this big, huge valgus collapse that takes her knee out and takes her ACL out as well. And she also had a meniscus tear in there as well that as a result of that injury as well. And then the last one is called just the dynamic snowplow. Once again, we're losing uh, the edge off that uphill ski, trying to recover. She kind of gets into this valgus flex back weighted position again, and then just pop, there it goes, and then it's a done deal. So those are kind of the four main mechanisms that we're seeing in alpine racing. Now the real big question, or the holy grail, is really, can we prevent any of that happening by training the athlete? Well, we think we can at least train some aspects of it by landing mechanics, making a stronger athlete, and the combination of those two, I think we'll at least see some decrease in numbers. I think we won't totally alleviate the injury itself, just because when you combine a long lever arm to your lower leg, I think you're just kind of putting yourself at risk uh, for that type of injury. So kind of coming back to this Van Mechelen model again, if we're going into the third step, now we want to introduce a preventative measure, because now we know what's happening, we know what the mechanisms are, so now we want to introduce a preventative measure. And one of the, one sport that's really taking this to another level is soccer. Several different injury prevention programs occurring out there. The one on the left here is called the FIFA 11 Plus, very popular around the world. FIFA has really taken a huge step in presenting this to everywhere in the world to get people doing this. As you can see, it's a 3-step process, so there's progression. It starts with a 6-week program in the preseason. You're doing it as a warm-up and then continuing it once or twice a week throughout the season. So they're really seeing some good returns on this because they've now been able to go back and do some validation of the process itself, and they know that they've been able to decrease injuries from to almost by half in some cases. So, and a lot of this, the PEP program here on the right was kind of developed by Scott Mandelbaum and the people out in Santa Monica. And actually, a lot of the components of the FIFA 11 are the same as the PEP. So our goal at USSA is just to try to come up with our own FIFA 11 to be able to introduce to skiing and snowboarding. We're probably going to see that our intervention itself is going to resemble a lot of the same mechanics, a lot of the same exercises, with maybe a few specialized ones for skiers of themselves. So I'm working with the Stedman Philippon Research Institute to come up with a study based on it. We're going to try to introduce it at the Coaches Congress next May to try to get out to clubs and start our own program and have some clubs begin doing this program in the dryland season before their season starts, and continue through the season to see if we can have an effect on those injury rates. So just kind of going back, we want to assess the effectiveness. So that's kind of the idea. So we've had, we started a club injury surveillance project, I believe, a year ago, which we got several clubs involved in recording and reporting their injuries that are occurring, so we can kind of see, kind of going back to that same first step in establishing the extent of injuries that are occurring in the clubs. But we know that the injuries are very common, so that's really where we're putting we're putting our eggs in that basket for right now. And I think as we move forward, we start seeing how many head injuries out there. Are there preventative measures that we can do for concussions? Is there anything that we can do to prevent hand injuries? The skier's thumb, shoulder injuries, things like that. But right now, we're really kind of looking at knee injuries, and we're just getting off the ground. So certainly, we're going to ask your guys' help in some of these injury surveillance projects, as well as the ACL intervention project that we're going to be introducing next spring. So that kind of does it for me in this injury prevention kind of talk. If there's any questions for me, I'm more than happy to try to answer. And also, if you have any questions in the future, you can always get a hold of Brian or myself via email or phone call. I'm always happy to help you out. Okay, first question from Murray says, are there any free skiing prevention ideas? We're trying to work with the free ski coaches to kind of figure that out. I think what we want to try to do is take we're taking a step back with free skiing because we need to establish what those mechanisms of injuries are occurring there. We know that they're different. Certainly, athletes dropping 30, 40 feet out of the air creates its own issues in itself. So Julian Bauer, who's my associate here, who kind of leads most of our research, is working with the IOC right now. Lars Ingebrigtsen made some comments a year ago in March at the IOC Injury Prevention Congress that really kind of stirred the pot, or kind of stirred the hornet's nest with this. And so he's actually looking at getting some IOC funding to look at free skiing injuries in and of itself, particularly in slope style. And so it's moving forward, but right now what we're recommending is having good, healthy, strong athletes out there, and then also looking at training circumstances, the weather, the course itself, and things like that. Next question is PEP program. Is that available online? It is, and I can get that information to you if you're interested in it. If you can probably just search Privit, PRIVIT, and it'll come up. I know that they've recently signed on the Canadian Ski Federation as well to do this. And it's very cheap. What I didn't tell you before, it's really cheap to use. It's $10 an athlete per year. So, it's pretty cheap for what you're getting. So. Another question is, what about free ride prevention ideas? That's a good question because we've seen our elite athletes not just get hurt in the training course, but when they've just been riding around the mountain. So I think what we want to look at is like recovery techniques and when to get them off the hill. Certainly skiing around after a training session where their bodies kind of eat may not be the best circumstance in that. But it's very difficult because particularly in snowboard and free ski, those kids will ride all day, every day if you let them. And so it's a lot about educating the athlete of putting themselves out there a little too much and the risks that they're taking with that. Another question, we're asking about concussion assessment and prevention. Yeah, I mean, a lot of these studies and a lot of the prevention techniques kind of follow the same model. Looking at how concussions are occurring and are there factors involved to preventing that, will definitely kind of move forward. We know that building neck muscles now seems to have a good preventative effect, so incorporating that into the dryland training is a pretty simple thing to do. Helmet technology is getting better, but we know that because the brain is free floating in your skull, that a helmet will prevent like major trauma to your head, like a skull fracture, but not necessarily a concussion. Okay, if that doesn't, I think we're all good. Oh yeah, I'm going to turn over to Brian real quick.
Great. Thanks so much to Kyle for this presentation. Really helpful perspective for the clubs out there. And one thing I would suggest in terms of driving this at the club level, and even the questions coming in about free skiing and snowboarding, is this presentation and just some of the metrics that Kyle mentioned are being measured at the FIS level. The types of injuries and the mechanism for injury and the cause of the injury, those are all really good templates for you at the club level to, if you start tracking things along those same lines, along those same metrics, there's more and more we can do to start tracking the same things at the club level and at the junior athlete level. So I would encourage you to this webinar, as all the webinars, will be recorded and posted. And so if you have an opportunity to come back to it, or if you jotted down some notes, I would just encourage you, from your own injury reporting, from your athlete screening coming in, your annual physicals, the more you can model some of the studies and some of the data that Kyle referenced, the more we'll be able to compare that to like studies at the FIS level and the IOC level. So again, a couple of you came in late, and so this will be recorded, or it was recorded, and it will be posted on the Club Excellence Workshop homepage. So please be sure to check that out. And if you want to distribute this to other coaches or other club leaders, feel free to do so. It will be there in the next 24, 48 hours for you to look at that, as well as all the former webinars that we have produced. So thanks for your time today, and have these last questions been answered in the chat? And the chat, if you need to go ahead and grab anything out of there, I will leave the session open for a few minutes, and then we'll close up, and we'll look for you next month for our November webinar on Club Excellence. Thanks so much.